We've all experienced a cut or laceration from time to time, and as it so happens, I actually cut my finger on something sharp this morning. So I'm here at the Wound Care Clinic of South Jersey with my friend Larry Lodico. He is a wound care specialist, and he's going to fix me up. It's certainly not a bad wound. It's nothing like you normally
So what did you
fix
do,
up.
Robin?
I was closing up a trash bag, and I think there might have been a can lid in there and slit my finger open, and I couldn't get it to stop bleeding.
Well, you're in the right place. You're
I
in
know.
for a treat today. We're going to use a wireless form of microcurrent wound care
Okay,
and treatment.
that's great.
So the first thing we're going to do when someone cuts themselves or they have an open wound, we're going to clean it thoroughly and reduce contamination and bacteria.
Okay, so what I did was as soon as I cut myself, I ran upstairs and dumped alcohol on it.
Okay, well, alcohol is a very aggressive antiseptic and it usually burns like heck. So
does.
usually we use something for initial and acute wound like hydrogen peroxide when we cut the skin.
Okay.
And then we dry it off, we put a topical antibiotic and a sterile bandage.
So always have that available in your house.
Absolutely. And if it doesn't respond within 7 to 10 days, you need to see a professional.
And do you put a Band-Aid on it right away, and do you leave the Band-Aid on?
We usually want to change, especially a finger like this, we might need to change this dressing anywhere between 2 to 3 times a day.
Okay.
Depending on how much drainage.
You don't want to leave it on and let it get kind of moist. That's where bacteria can
No,
grow.
bacteria can grow and then you'll get an infection.
So you got to be careful with that. But you do say to keep it covered. You always hear,
Absolutely.
let air hit your wound.
Well, you keep it covered, but you need a moisture balance, okay? So you don't want it too wet, you don't want it too dry, you want it somewhere in the middle so those cells within the skin can proliferate and heal faster.
So now what is this?
This is a dressing called Procellera. The bioengineer who developed this displays it as microcurrent. So each individual brown dot on this dressing represents a 1-volt battery. And when it interacts with the wound fluid or some sort of liquid, it will immediately get active and start promoting the wound healing
Am I going
process.
to get electrical shock?
Sometimes you can feel tingling.
Really?
Yeah,
Okay.
absolutely.
I was kidding, but maybe. Let's see. That's amazing. It really is.
Well,
Amazing
and it's now
technology.
approved by Medicare and most insurance. It's actually billed as a contact layer. And the price has come down significantly, so anyone can afford it.
Oh, that is great. And
One
does-
4x5 piece is only $10.50.
Oh, that's amazing.
Absolutely.
So, and this speeds the healing process. How does it actually work?
Well, actually, we're experiencing electrical responses all day long within our bodies, okay? So the same goes for cells within a wound. So there's these things called ions, the chemical interchanges within cells that are constantly flowing back and forth. So this is delivering an electrical response directly in a wireless manner and promoting those cells to get extremely active so they can heal faster.
That's amazing. That's really great. And I know this is just a small wound, but this can work on much bigger wounds.
Absolutely, they can on sports injuries and or diabetic foot ulcers, venous leg ulcers, pressure ulcers, and complicated surgical wounds.
And really speeds up the recovery process.
It expedites things usually by about 50%.
That is amazing. Again, what is it called?
Procellera, microcurrent,
All right.
wireless electrical dressing.
All right. My friend Larry Lodico is fixing me up with Procellera.
Microcurrent, wireless electrical dressing.
I'm glad you said that. Okay. Thanks so much, Larry. We're here at the Wound Care Clinic of South Jersey in Northfield, and I'm already feeling better. I'm Robin Stoloff, and you're living well.